So what we're going to be doing is having Caleb on the floor here in a moment. And the reason why I have Caleb and other individuals on the floor when we're working with eye movement skills, and people that are looking at the videos might notice that Caleb's right eye is overshooting, turning in. He has some convergence excess, esotropia. Right eye, he has right now no awareness of seeing in 3D, depth perception. So what we're going to do, Caleb, is that I want to work with your eye movement skills, eye movement control with your right eye only, left eye only, and then both eyes open at the same time. But what I'd like you to do is to sit on the floor and put your feet all the way underneath the chair. All the way underneath the chair. There we go. And put your head on the floor. That's it. And bring your feet closer together. That's it. What I'd like you to do is when you're on the floor is to pretend that you are a statue. How much do statues move? You can tell me. Do statues move? You're doing a statue really well, Caleb. All right, so you can do some things that a statue can't do. You're allowed to breathe. Don't stop breathing. Are you breathing? You can blink every once in a while when you need to blink. Don't stop pumping the blood through your body. But the reason why you're on the floor is that when we work with eye movement skills, I want to isolate the eye movement skills separate from the body. And so what we're going to do is have your arms down to your side, like that. Let's take your glasses off. And this is Caleb's patch, and he has it in his own bag. And what we're going to do is put the patch on your left eye first. So pick up your head. Up you go, like that. And so what we're going to be doing is working with pursuits, and then saccades, jump eye movements, pursuits or tracking, saccades, jump eye movements, and work with convergence in a moment here. All right, so bring your arms down to your side. And what I'd like you to do, you've never done this before, have you, Caleb? All the way down. Bring your hands down. This is going to be probably the most difficult that you've done because this is the first time you've done this.
I need to rub my eye.
Try not to. Blink, blink, blink. Is the patch going up against your eyelashes? And he's probably saying he wants to rub his eyes because we have his glasses off. And he has a +200 in his glasses. And so he likes to have his glasses on. And so we're going to do this with glasses off. All right. Try your best not to rub your eyes. Does your eye hurt? Does it feel like your eyeballs are going to pop out of your head? A coach will say, if you don't feel the pain, Caleb, you're not going to make the gain. So here we go. Do your very best to follow the leader. Do you see the silver bead? Okay, follow it with your eyes. Where to go? Here we go. Do your very best. Go to your left. Go to all the way to your right. And you can see that Caleb is losing a fixation of the target. There you go. It's going to get better and better each time. Is this the hardest thing you've ever done in your life, Caleb? I thought so. So this is the bar. This is the hardest thing he's ever done in his life. Here we go. Follow it.
I saw 2.
You saw 2? And you might see 2 because of the light space. Did you see 2 from peeking around the patch, which can happen? Let's just do your best. You might see 2 every once in a while, okay? Let's try this. Here we go. If you can, bring your left hand down.
I saw 2.
Okay. All right, you tell me when you see 2. You tell me when you see 1.
I saw 1.
Okay, here we go. Follow the leader. Follow the leader. You're how old, Caleb?
4.
4. Okay. He's a fantastic 4. Here we go. Follow it, follow it. It's really hard for him to fixate with this eye.
I got 2.
Yeah, okay. Here we go, here we go. And try to have your legs down. Look at the silver, gold. So the jump eye movements is a saccade, silver, gold. Silver.
I got 2 gold.
Okay. Gold. How about now? Look at the gold and the silver and the gold and the silver, gold, silver. This is really hard to do, isn't it? Gold, silver, gold, silver. So again, I don't want to tell Caleb how I know that his knees are up in the air. Well, he'll figure it out after a while. Because part of vision therapy is not only to work with eye movement skills and control, which are important, pursuits, saccades, convergence with both eyes open, but we're also going to be working with visual thinking, visual processing, related to who, what, when, where, and why. When one starts to think who, what, when, where, and why, who are you? What are you doing? When is it right now, time and day? Where are you, north, south, east, and west? Why are you doing something? Who, what, when, where, and why are novel concepts to help the individual to start not only to think on their own, but to think outside of the box, think outside of the book. Here we go. Follow the leader. Where's your eye? That's it. Thank you very much. This is hard to do, isn't it, Caleb?
I got 2.
Okay.
Silver.
Okay. Keep following it. There you go. Where to go?
2 silver.
Okay. And you can tell me, but keep your hands down to the, that's it, to the, that's great. I know this is hard to do.
2 silver.
And what I mentioned before in the other video is that when we
2
have
silver.
bucking broncos and wild stallions, eventually what we might be doing, I'm not sure about yet today, but putting some sport weights on the ankles and on the thighs, on the wrists. Follow the leader, Caleb. Here we go. Here we go. Where to go? And so you can see that Caleb is having a lot of difficulty with his eye movement control. And what we might find out down the road 9 months from now, see how Caleb's eye movement control is later, if he might have 31-hour visits once a week or so. Here we go. Follow it. Follow it. This is hard to do. Look at the bead. Look at the bead. Look at the gold, silver, gold. Where's the gold? That's the gold. Thank you. Silver. Find the silver one. Where's the silver? Where's the silver? I'm going to go to your nose. I'm going to go to your nose. Bingo. Bingo. Look at the gold, silver, gold, silver. A lot of people think that you can't offer this kind of care to 4-year-olds. Gold, silver. Caleb is doing this really well for the very first time. Gold, silver. Where'd the silver go? Where's the silver? Silver. Find it, find it, find it, find it, find it. There you go, there you go, there you go, there you go. Do you see yourself in there? Can you tell me a color that you see in there? What color do you see?
White.
Oh, good. What is the white that you see? Can you tell me what the white is that you see?
A blanket.
You see a white blanket? Okay. Do you see any other color in there? Okay. Look at the gold, silver, gold,
2 silver.
silver. Okay. Follow it, follow it. Look at it, look at it, look at it, look at it. There we go, there we go, there we go. Keep looking at it. And again, I'm looking at his pupil size. As I bring the target closer to him, he's still looking at it. His eyeball is pointing to my bead. Now the eyeball's pointing somewhere else. When we shine light into the eye, the pupil gets smaller. When we take the light away, the pupil gets bigger. but there's also pupil change that happens when you're moving a target closer and closer and closer and closer. If the individual keeps it clear, the pupil's going to get smaller, smaller, smaller. When the pupil releases, opens up, then the individual is seeing blurred. And what I can do is offer the instantaneous feedback and say, Caleb, look at the bead. Where's the bead? Caleb, look at the bead. Make it clear. Keep looking at it, keep looking at it. And so you can tell that his focus and attention is all over the place. Pick up your head. Up, 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 up. There we go. Now we're going to work with convergence. And so when Caleb's mom is driving in the car and they're looking straight ahead, when they're looking straight ahead on the superhighway, their eyes are parallel like railroad tracks. And as you get closer and closer to objects of regard, the eyes turn in towards each other. This is called a convergence. And sometimes people have a convergence insufficiency where the eyeball drifts out. When both eyes are still on, the individual might see double. If they see double, if their world is doubled, the doubling of the environment is very disordered, and that can lead to disorderly conduct and behavior. Or the eye might not converge, but it might overshoot, and this is called a convergence excess. This is called a convergence insufficiency, and this can be called an esotropia, esophoria. This can be called an exophoria, exotropia. But what we're going to be doing here with Caleb is to work with his convergence skills. And I know this is really hard for him to do this for the very first time. All right, so get your body lined up again. Here we go. And the reason why Caleb is on the floor is that we're working with his eye movement skills without having any influence with his body movement. And it's going to be difficult for him right at first, but try to bring your feet closer together. That's it. There we go. Look at the bead. How many beads do you see? Keep looking at it. Here we go. Follow it. Follow it, follow it, follow it. Look at it. Look. All right. Try to look at it again. Try to make it one.
One.
And how many sticks when you see one bead? Keep looking at it, keep looking at it. So we're working with pursuits. We're working in a moment with saccades, jump eye movements. We're working with convergence also. And so we're also working with visual attention, Where to go, Caleb? Tell me when it gets blurry, tell me when it gets clear.
It got clear.
Okay. How about now? Follow the leader. Follow the leader. There you go. Good job. You're doing really well for the very first time. Look at the gold, silver. Where's the silver? Gold. So he's looking at these wolf beads, wolf wands, gold. That Bruce Wolf, he's since passed away, but he was the team optometrist for the Cincinnati Reds in the late 60s and 70s when the Reds were the big red machine. Silver, gold, silver. When the Reds dominated the National League, power hitters, World Series wins 1975. Look at
gold.
Silver, gold,
Two gold.
silver. There are ways for a batter to have the bat in the hand and look at the ball that's being pitched to the batter and visually make the ball bigger, visually make the ball slower. Your batting average is going to go up when you look at the ball and look at one ball and not see two. Silver, look at the silver and the gold and the silver. What we're going to be doing next, Caleb, are the flippers. Here we go. Let's see if look at this silver bead. Can you make that clear? And
I made it clear.
Yep, and now he's alternating. The right eye turned in, then he's fixating with the left eye. Sometimes the left eye turns in and the right eye goes to fixate. Look at the bead. I know this is difficult for Caleb to do at first. It'll be easier and easier in time. Look at the bead. Can you find the bead? How about now? How about now? How about now? That's a minus a half, plus a half, minus 0.50, plus 0.50. These are the flippers, so we're working with focusing and flexibility. Can you clear that? Can you clear that?
Yeah.
How about there? How about there?
Yeah.
How about there?
Yeah.
All right, let's do this. Here we go. Here we go. Can you do that one?
Yeah.
Can you do that one?
Yeah.
Which one's easy? Which one's hard? They're both the
Both
same.
of them.
Both of them are easy or both are hard?
Both are easier.
Okay. All right. All right. So that was a minus 150. This is a minus 2, plus 2, minus 2, plus 2. We'll keep working with this. All right, Caleb, something's going to happen now. Let's put on this special pair of glasses. Prism base down in the right eye, bright lens. You see 2 of me? Good. You should see 2 of me and not 10 of me. I don't want to tell you. Later on, I'd like you to figure out, why do you see 2 of everything?
I see 2 of you, one on the bottom and one on the
Good.
top.
Take both sticks. Can you take them? Where are they? And put both sticks into the 2 straws. Can you do your best? Just try your best. Put the sticks, here we go. Put the sticks into the straws like that. Go. This is going to be hard to do because this is the first time you've tried this. And so what he's going to be doing, because in time he's going to be able to judge the distance between the stick and the straw, because Caleb has difficulty seeing in 3D. He has difficulty discerning 3 dimensions, depth perception, and in time it's going to get better and better. That's it. When you get it in there, push all the way to the stopper. Good job. Take it out with the same hand. So Caleb has prism base down in the right eye, right lens. Switch hands. Switch hands. Put it in your non-dominant left hand. There you go. Just do your best trying to put the sticks into the straws. And he has base up in the left lens. Take it out with the same hand. Switch hands. Push until it stops. Take it out with the same hand. Switch hands. Push until it stops. All the way, all the way, all the way. Thank you. Now, you can leave it in there. Let's take that pair off. Let's put this pair on. So we're going to be switching the doubling prism. So he has base up in the right lens, right eye, base down in the left. We have the spacer here because his body temperature is warmer than the inside of the lenses, and this will keep the lenses from steaming up. How many sticks do you see?
2.
Good. You should see 2. You should not see 3. So take sticks. Grab them, find them. There you go. Put both sticks into the 2 straws. And you're doing great, Caleb, by using one hand at a time and not using your other hand, because that's what we want you to do. Try your best to put the 2 sticks into the 2 straws. Push until it stops. There you go. Good job. Take it out with the same hand. Switch hands. Good job. And he's doing what he's supposed to. Find it by seeing, not by touching. He's doing great. This is really good for the first time he's tried this. Take it, that's it, all the way to the stopper. Take it back out. Switch hands. That's it. One hand at a time. Caleb, you're doing this really well. Push, 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 push. Take it out all the way. That's it. Switch hands. Switch hands. There you go. Good job, Caleb. And so what we're going to find over time is that Caleb is going to have better control of his right eye, better control of his left eye, doing some things that we call vision training, vision therapy. People have heard of physical therapy, they've heard of occupational therapy, they've heard of speech and language therapy, speech and hearing therapy. Most people have never heard of vision therapy. Vision therapy started with optometry back in the 1920s, optometric extension program 1928. Developmental functional optometrists in the 1940s. Jerry Getman and others encouraged Jean Ayres to start the profession of occupational therapy. When I have occupational therapy students, take it out with the same hand, come over from the University of Findlay. They know their history of their profession of occupational therapy. They know Dr. Jean Ayres. They know about her. None have ever heard that she was encouraged by functional optometrists to start occupational therapy in the first place. So occupational therapy has its roots within optometry. So we can talk about functional vision care, function of the two eyes. When you look through binoculars, you're using two eyes. Not everybody who has two eyes see one. Oh, thank you very much, Caleb. So let's let you get up and off the floor. You did very well. Thank you.